New videos every day.
Life, wisdom.
Hello everyone, this is Dr. Echols again, and I have a special guest with me today. This is Trevor. Hi Trevor, how's it going?
Good.
Good. And I understand you've never been to the chiropractor before.
That's right.
Are you nervous?
No.
Good. Well, there's no need to be nervous. Chiropractic's very safe and pretty effective. And so I want you to tell me a little bit about some of the things that you've got going on.
I've got a crazy thing in my neck for about a month now that it makes it hard to go like this. Happened when you wake up at night and you have to move your pillow and you lift your head kind of weird. And I was like, I felt it right there, and I was like, oh no, because usually it hangs around for 3 to 5 days, and this time it's been a month. Oh, okay. And then I also have a chronic little pain spot in my back, which is
right in here.
Right here, and I think it has to do with posture problems. Because it's hard to sit up straight all the time.
Sure.
And so. Okay. But I guess that's about it. And then I've got something kind of sticking out of my shoulder right here. I don't know if you can feel that.
Yeah, I do. I do. So feels like you've got a little.
I'd love to know what that is. I did that. It makes it hard to do certain things. It feels like sometimes it feels like my arm is becoming detached or something.
Yeah.
You know what that is?
Yeah, I think this is what we call a lipoma. A lipoma is just a little fatty growth there. They're really benign. There's really no need to be concerned about them unless...
That's what I was hoping for.
Yeah, unless they are actually interfering with something or become painful. Sometimes they'll cut those out, but oftentimes they'll just grow back. So if you can leave them alone and just let them alone, then that's a better idea. But like I say, sometimes if it's interfering with function or it's very painful, sometimes they'll just incise it and remove that.
It's not painful, it just sometimes it feels like my arm is not properly attached or something.
Got it.
That's about it. Those are the three
things? Yeah. All right, well, let's focus first of all on the neck. Now, listen to what he's told us. He said that he's been having neck pain or neck discomfort, and that's been going on for how long now?
This time it's been about a month, but it's been going on for about 10 years, but usually it's about twice a year it'll get out of whack for a few days. Right. But this time it doesn't want to go back. So
this is really important because he's telling us that he's actually had this problem for a long, long time, 10 years or so. But what happens is it only bothers him for a few days, and then he kind of gets over it, and then he just goes on about his way. But now, nothing was ever done about that problem. So now it's started coming up, and now it's not lasting for 3 days, it's going on for a month. So this is a perfect illustration of why when your body's giving you signals, you should do something about it. Trevor, I'm not picking on you here. I'm just kind of letting you know, because if somebody said, well, my oil light comes on in my car, but it only goes off on the car when I go around the corner. And then as soon as I go around the corner, it stops and everything's fine. Well, okay, but you should stop and put some oil in your car. Stop, get yourself fixed. Otherwise, these problems just keep going on and on. The 5 most dangerous words, or maybe it'll go away. Is that 5 words? I think it is. But maybe it'll just go away.
So I should put oil in my car?
We're gonna put some oil up here in your neck. I say it's like spreading WD-40 here on your spine here. But what Trevor has been telling us is that, he thinks he's kind of sleeping on his neck wrong or whatever. And that's what most people say. But really what it is there's some sort of a malfunction going on here. And as he goes on through his life, it just kind of gets worse and worse and worse. And the facts of the matter are, the spine can be about 80% damaged before you even know that there's a problem. And that's not only true with spinal problems, it's true with all kinds of disease. Cancer's that way, diabetes is that way. You really won't know that you even have the problem until it's about 80% broke. So wellness is not a matter of just waiting for symptoms to come and then trying to fix it. It's an active process that we're engaged in to maximize the functioning of the body. And of course, our spine is central to that. He's already mentioned that he has poor posture. He more than likely has poor posture because there's something wrong with his spine. When the spine is in a proper alignment, posture is normally pretty good. If the spine's crooked or slumped, then you're going to be crooked or slumped. So trying to forcibly hold a correct posture doesn't work, doesn't seem to help things. By correcting the spine, then the posture is actually corrected by itself. So the first thing we're going to do is see if we can just figure out what exactly is wrong with his neck. Now, Trevor, I want you just to sit up nice and tall, look forward. And he looks like he's still got some curvature in his neck, which is normal, which is good. He might be missing a little bit. So we're just going to do a few easy orthopedic tests and see how he responds to that. Trevor, I'm going to lift up lightly on your head like this. I want you to let me know if it feels better or worse or no different, okay? You're kind of tall. All right, here we go. Does that feel better, worse, or no different?
No different.
All right, so if I put any pressure down, is there any discomfort here?
No.
Good. Tilt your head this way for me. Is there any discomfort here?
Maybe a little bit in that spot.
Okay, whereabouts
Like
is it? Right here.
Like
Very good. All right, tilt your head this way. Is there any discomfort here? Okay, so we learned a couple of things here. First of all, if we look at Trevor's head, he can really bring it over to the side. See how far he can move it here? I mean, the vertebrae are functioning pretty well there. But when we try to go this way, look how much less he can move it. So we've got something over here that's binding up. We think about those vertebrae as moving together. His really aren't. And when we did the test where we pushed here, it showed that we may have a pinched nerve in this area because it was more uncomfortable for him when we went to this direction. So we know now from this little bit of an exam that we've done with him that some of the vertebrae aren't moving in the correct way and that there could be some possible nerve irritation or entrapment here in this part of the spine as a result of that. So as a chiropractor, what we're going to do is we're going to go in there and we're going to restore that normal function and that normal motion to the spine. This is a mechanical problem. It's not a chemical problem. Most people, if they're not very well informed with this kind of problem, they'll just take an Advil or a Motrin or maybe get an injection or something to try to handle this problem, and it may temporarily fix it, may make the pain less, but it won't, of course, correct it because it's a mechanical problem, not a chemical one. And when we try to handle mechanical problems with chemicals, we're often kind of disappointed.
It does hurt more when I get drunk.
Does it? Okay. Well, that would be a chemical issue. Now, Trevor's also got a pretty nasty knot right here in his shoulder. And this is a result oftentimes of this muscle going into spasm due to the nerves being irritated up and through here. This is the trapezius muscle, fans out through here.
I feel like I should tell you that I spend a lot of time playing guitar, I play music.
Yeah.
So it hangs on me. I've been playing for like 28 years. So
wow.
Anything that starts to like,
sure.
That's what that is.
Sure. So that, that playing the guitar and that repetitive motion thing can actually set up problems here in the spine and cause issues like this. The danger with leaving something like this is that when a vertebra, one or more vertebrae are out of the normal position and they stop moving properly, it actually starts to cause arthritis to start forming on the joints. And then the problem starts getting worse and worse and worse. And by the time the person finally goes, I'm starting to get really stiff, I probably should go get it checked out, the damage can be pretty severe or even permanent at that point. So we've located an area where he can't really move his head very well and that he possibly has a pinched nerve in there. So we're going to set up and give him an adjustment, and we will see if we can't give him a little bit of relief today. So when you get an adjustment, you're going to hear a little clicking sound. That's nothing breaking, all right? It's just the sound of air that's escaping from that joint, okay? So you could get a little bit sore from your adjustment, just like if you went to the gym and you worked out, you could get a little bit sore, but don't worry, that's perfectly normal. And on the other hand, you may not get sore at all. You may just feel a sense of relief from that, okay? And let's see what we find here. Now, Trevor's problem was over here on this right side. And so what I'm going to do is we're going to gently turn his head this way, and I'm going to kind of feel of these vertebrae to see which ones are moving and which ones are not. And as I move down through the spine, I can feel right in this area, right where he's having some pain, this is the area that's not moving so well. So a little click, just like that. That's kind of a big click, wasn't it, Trevor? Yeah. And it felt pretty good, didn't it? Yeah, he's laughing. So what we've done is we've taken a segment of the spine that was locking and wasn't working, and it was immobile, and it was actually degenerating. It was starting to put pressure on the nerve, a mechanical problem, if you will. And we've actually started to restore that normal motion. I always joke with my patients. I say, this is like spraying WD-40 on that joint and get it to move a little bit better and so it doesn't rust up, okay? All right, Trevor, let's check the other side of your neck here too as well. Okay, now do you get headaches at all?
I have been recently.
Okay, so this vertebra way up here at the top, when it's out of position, it can oftentimes cause headaches. These nerves from here radiate back up into the head. So again, we're going to just gently move that vertebra like that. Very good. And that may actually start to relieve some of those headaches that you've been having as well. Now, one of the things that you may start to notice is that these muscles start to relax a little bit more. When the nerve is pinched up here, it's going to fire. It's going to not be very happy. What are the muscles going to do in sympathy for that? They're going to contract up. So as we take that pressure off, then the muscles will actually calm down. We get a lot of people who run to the massage therapist every week because these muscles are just like a turtle shell up here. And they have to go back every week and get them massaged. And the reason that is because since the nerves and the spine are, out of place and being pinched, it causes those muscles to go into spasm. So sometimes getting some chiropractic work in conjunction with your massage therapy can really go a long, long way. All right. How are you feeling there, my friend?
Great.
Excellent. Yeah. Very good. All right. So, Trevor, let's have you sit up on the table for me. Just sit right there. Now, let's have you gently move your head this way. Now see, it's still a little bit restricted compared to the other side. But when you move it this way now, how is it feeling?
Normal.
It feels normal now. Okay, excellent. So I think just a little bit of work with this area of your spine to get it restored to normal function, and you'll be doing a lot better. Okay, now let's address this area that you were talking about in the upper part of your back. How long has that been going on?
Okay, this is a much more chronic problem. It's been a few years probably. And sometimes at the end of the day I can feel it. It's usually okay early in the day, but hunching over the guitar for too long, that kind of thing.
Sure.
It's pretty serious, I'm sure. Pretty
serious. And is it right back in this area?
Yeah.
Right in here?
You're just about right on it.
I'm about right on. Okay. Very good. Now, does this hurt if you take a deep breath? No? Okay. Okay. Sometimes we'll notice that if somebody has back pain and it's worse on inspiration, oftentimes it can be a rib where the rib attaches to the spine, can be slightly out of position there. And that wouldn't be uncommon with him, especially turning and twisting and strumming his guitar, that a rib head could actually slip out of place a little bit. But he's not really having any pain radiating around to the front or through into the chest. So this sounds more like just an issue with the vertebrae themselves. So I'm going to kind of push on the spine lightly here, and you let me know if there's any tenderness anywhere. Nothing through there at all?
So far.
Good. All right.
It's on the right side.
It is. Okay. So you get it more in here? All right. All right. So I'm going to show you how that we would go ahead and give an adjustment to what we call the thoracic spine or the mid-back area. And Trevor, if you'll go ahead and lay on your stomach for me. So I'm feeling of his spine. This is called palpating. We're palpating his spine, and we're looking for areas that may be misaligned, or maybe any swelling or inflammation that's there. And I'm just going to kind of gently give him a little stretch through here to kind of warm these muscles up a little bit. Trevor, are you doing all right there?
Yep.
All right. So again, you may hear a little bit of a click in through this area. Breathe out for me all the way there. Good. There we go. And that moved real nicely. So we've restored some normal function back into that spine, whereas before it was kind of locked up through here. And hopefully that will help him to feel a little bit better and to get these muscles quietened down a little bit. How'd that go down there? Not too bad?
Good.
Very good. Yes, you did. There was quite a bit going on there. So that's real good. We'll be anxious to see what kind of response we get from Trevor in the future. So I hope this video has been helpful to you. If you have any questions, please go to my website, www.jeffechols.com. Feel free to call me. I do consultations on the phone. I can help you in many different ways. So I hope this has been helpful. And until the next time, have a good one.